Good afternoon, everybody, and thank those of you who are here for coming. I'm so glad. My name is Elaine Poker-Yant. I am new this year to the AzNHA board. I'm chair of the education committee. I work for a company called Successful Aging AZ, and I'm an associate member, and I'm so happy that you are all joining us today. A couple of announcements. Just everybody make sure your calendars are marked. Our conference this year is on Friday, August 23rd. Please plan to join us. If you would like to be an exhibitor or a sponsor, just check out the website, AzNHA.org to register. Attendee registration will open on May 1st. Next month, our education program will be on May 15th, and our guest speaker will be Charles Scott, who is an accredited investment fiduciary, a certified dementia practitioner, his wife Sherry, who is the client concierge, and their company is called Peloton Capital Management. But what they are going to be talking about are some brand new products for long-term care. There's a lot new in the industry, aside from some very boutique products. There's a game changer coming out there, and it is a care policy that you can get as an older individual, and you can get if you are already ill. And it's really like return on your dollar for investment. So they're going to talk about that, as well as just some really incredible tips for home care owners to be able to share with your clients on how to use their policies better. So I think it's going to be a really enlightening session because the products are new and they're mind-bogglingly accessible, which we don't hear that very often, right? So today we're going to get started with Brian Bruni. Please remember to mute yourself. As long as your phones don't have to be on silent if you're muted, but we will have Q&A at the end of the session. You can put your questions in Zoom if it's something that we need to chirp in on. Kate is here to do that and chirp in and get those questions and ask them timely. Otherwise, we'll hold them till the end. We're recording this session. It will be posted on our website for future reference. And I'm so pleased to have Brian Bruni with us here today. He does the sales and marketing for health testing solutions and started with the company last year in 2023. Brian opened and operated the Assisting Hands home care franchise in Sun City before coming to work for health testing solutions. And he's got 15 years of experience in business, project management. Brian is a former law enforcement officer and is passionate about improving the lives and health of others. And he transitioned to health testing solutions to be able to share their services with people across the country. It's a very unique situation where people have access to cognitive testing, which is a miracle. Please welcome Brian Bruni and all of his incredible information. Thank you so much for being with us, Brian.
Thanks, Elaine. I appreciate it. Information. So if anybody has any questions, comments, concerns, obviously you can reach us by that number. But the best way to get in touch with me is that brian@htshealth.com. So again, like Elaine said, I started with health testing solutions just last year after owning and operating the Assisting Hands office in Sun City, which I absolutely loved. And we're able to help lots of people and knew I could help thousands of people. And when this opportunity came on, I took that opportunity to come on because we are a national company. We're actually based out of Florida for our medical license. And then our operations team is here in the Phoenix metro area, but we're able to work, and I'm currently working with multiple states and communities, home care, all over the place. So I'm excited to bring that. We're just going to talk a little about cognitive health and brain therapy. I know it's one of those things that I did a conference just earlier this morning and had a table, and when people walk by, they're like, oh, thank you. And then they just they don't want to talk about it. They don't want to think about it. But it's one of those things that we definitely need to change that stigma and really start talking about more And obviously with everybody that's on the call and the owners, it's something that's prevalent in our everyday lives. So we just need to get that information out there. So just what are some of the common concerns people have about cognitive health? And since we're kind of doing it virtually, I'll be the Q&A part of that. But memory loss, quality of life, the impact on their daily living, mental sharpness, the impact on relationships. Obviously, as you guys all know, that transition from loved one to caregiver is a stressful dynamic as it is. And then, as I just mentioned, the stigma that is part of this whole process of mental health. And then what is brain therapy? So brain therapy refers to a
I
variety.
lost Brian. Did anybody else?
I still have them.
Am I still there?
I still have you, Brian.
Okay.
How about everyone else? Does everyone else just want to shoot in the chat if you still have them?
Yeah, I just got him.
Oh, okay. Maybe it
He
was,
went dead when I said something.
oh,
Just what is brain therapy? Obviously, brain therapy refers to a variety of techniques and programs which are designed to enhance someone's cognitive abilities. And these programs often involve engaging in specific mental exercises or activities aimed at stimulating and challenging the brain. So we have a lot of people that play Sudoku or do crossword puzzles. They may play games like Bejeweled, but they don't really know exactly what part of cognition that's helping them with. Obviously, something is better than nothing. But that's what we want to make sure that people are understanding, that there's a way to be able to find out what they need. So some components of brain therapy: memory skills, working on coordination, recall. Obviously, in the home care setting, as everyone knows, coordination is a big piece with falls, recall, attention, problem solving, processing speed. So just something that I bring up. I know this is kind of a random talking about brain health, but what do we do if we have a problem with our teeth? That's something that we take initiative on. We typically go and seek consultation from professionals. They outline a care plan for us. Is obviously, if we're going in, routine maintenance, obviously like a 6-month checkup and cleaning. We do follow-up, and then we continue maintenance. So there's obviously other things that we do as well besides our teeth, but I thought this is a really good example of just how we take care of our other parts of the body, but we really neglect as a society. But in general, typically we neglect that brain health and taking care of that. And so when we talk about cognitive assessments, cognitive assessments, the early detection is really the number one thing that we look at, is detecting deficiencies in early stages. We allow for timely intervention and management. And this could potentially slow the progression of cognitive decline, and it improves the life for our clients. So obviously, as you guys know, in this business, you come across, or I joke that you don't ever come across the family that is in denial, right? Well, you obviously have families that are in denial, individuals that are in denial, loved ones. So being able to show them something concrete that they can look at is very important to really start that journey on making sure that they're healthy. Personalized treatment: when you really understand what's happening in that person, you're able to tailor care plans and suggest additional treatment. So along with brain therapies, if there's something that they need for speech therapy, occupational therapy, physical therapy, things like that, they can also take that under their control as well. Risk management: identifying the cognitive impairment early enables implementation of preventative measures and interventions to mitigate those risks, such as medication errors and falls. And then enhance client engagement. Obtaining these cognitive assessments, it really fosters that interaction with caregivers, even us as owners, and it empowers that patient to take ownership of their cognitive health. Now, obviously, there's going to be people that don't take care of their cognitive health, and that's their prerogative to do that, but we are able to help them along that journey. We're able to give them resources. You as owners are just have a blanket of a network of people that you can refer to for different ailments or suggestions. So, and it really gives an insight to the families, like I said, who may be in denial about that, and they can't see the current condition of their loved one. Obviously, you have families that come in that haven't seen them for 6 months or a year, and then that's typically when there's that emergency or that urgency to get them help. So being able to get that information beforehand is really crucial to preventing that big fall off, is what we really want to avoid. And we also talk about remote patient monitoring. This is something that we do as well. So patient engagement allows the patient to actively participate in their healthcare journey. And the proactive piece of that gives providers. So if they're working with a current general practitioner, those practitioners can see real-time data on, say, Mrs. Jones. They can look in on them, make sure that they're taking their blood pressure is okay, or their oxygen level is okay. They have timestamp data that's recorded, as opposed to potentially somebody that's forgot to take their blood pressure or doesn't document it correctly, and then helps prevent that readmission and keeps them at home where you guys want them to be. Gives a competitive advantages. Obviously, businesses who are utilizing RPM position themselves ahead of the others that possibly might not be doing that, and just gives another up on the competition. And then optimize resources. So RPM allows for efficient triaging of patients' needs, reducing unnecessary clinic visits, and keeping clients at home. Then mobile wound care is also something else that we do, but we really see a need for this out in the communities. We're in a lot of group homes throughout the Phoenix area locally, and even the larger facilities. We see a definite need for quality wound care. So obviously, if you have patients that are in their home, provides mobile care, brings healthcare directly to the patient, eliminating that need for unnecessary travel. If you have a patient that is hard or immobile as it is, to get them out, you're going to have to probably, or especially if they're bedbound, they may have to, you're going to have to call a transportation service specifically for bedbound patients. Moving them could potentially further injure them, but it just provides extra comfort keeping them at home. And then the continuity of care just promotes that transition from a care setting, whether it be a hospital or a post-acute, and that continuity of care from that facility to the home, making sure that they have that constant care, and there's no time missed in between. And then obviously timely intervention, ensuring wounds are assessed and treated properly. This is probably one of the biggest things that we've seen out there, is the quality of staff and the quality of care for that patient as a whole. So we saw the need for that, and that's again why we've done that to add to our Medicare services. I know I kind of run through that pretty quick, Elaine. I wanted to stop. I know I don't want to do too much commercial. I wanted to talk about that if anybody that's on has questions in regards to that, and then I can detail some of the services if needed as well.
So I have a question. What condition? So who establishes the remote patient monitoring? Is that something that you guys make a suggestion of, or is that only for people who have providers that utilize the RPM?
Yeah, so the way it works with us is each of our patients, and it's not to pick up any other services. You know, we're not looking to take over their primary care physician's role in that journey of that patient. But when we first connect with them, typically the way we're typically connected with somebody is that somebody is reaching out for the cognitive help. So we establish that patient with our clinic for the workflow of Medicare. So they would talk to our primary care physician. If they were determined to have a fit for our CogniFit assessment, they would be given a written prescription for that. They would do the assessment. But if it was somebody that wasn't going to do the assessment, that would be established during that call with the doctor. And that would be simply for if that person had at least one comorbidity, that workflow would go through onto Medicare. Just that we've established them underneath our clinic, and then we're able to send that equipment to them.
So they reach out to you because they want to be tested. You reach out to the PCP to get an order for it, and then you go with the testing.
Yeah, typically that's how we see it. It's not always. Sometimes we do get a direct, referral for remote patient monitoring. Typically that's more in the group home setting, but yeah, we could do that either way. But it's actually written through our doctors, so we would be able to set if we had a primary care physician that had we've set like primary care physicians that may be doing work with eight residents in a group home. We set them up the primary care as a clinic, and then that doctor is able to log in and get real-time data. Now, like I said, the reason we establish them as a patient is to send them that remote patient monitoring, the devices, but we don't do any other care beyond that. We do it for the billing workflow for Medicare.
Right. That makes sense. That part makes sense. I don't know. I feel like I'm missing the well.
Yeah, it's just an establishment with our practice, and then that RPM would that prescription for that equipment would come from our doctor.
Okay, so they do the test. So walk through the process. Like walk somebody through the process all the way, would you?
Sure. Do you mind if I just pull up it might be better if you're a visual, I can pull up that piece of the PowerPoint.
Yeah, that'd be great. I'm a visual.
So we'll do this one right here. Can you see my mouse pointer?
No, we lost the screen share. Or at least I did.
Let me see if that's
Okay, can you re-enable the
Let's see. Are you unable to do it?
let me see if I can do that again. I'm sorry, I wasn't sure. I got dropped off the screen share. Let me just do that again.
Okay,
How's that?
there we
Right.
go.
Okay, perfect. Let me just pull that up. Okay, can you see the pointer now?
Mhm.
Okay, so on the top, that gray where it says patient sign up, this is typically where we would get a remote sign up. So somebody that we're actually just getting ready to release this final piece of this, but this is where a patient would be able to sign up themselves, take a picture of their insurance card, and then schedule an appointment that works for a day and time for them. Now that typically is for the CogniFit. There's typically not people that are signing in for RPM. Now, could that happen? Yes, but 9.9 times out of 10 would be for us to do the cognitive assessments. So in a facility on the right hand side, a scheduled sign up at either an event, assisted living, memory care, they would be signed up with one of our team. And this remote piece would be for home care owners. So this would be something like you would be able to give them a link to our website. They'll be able to go to our website, do all that sign up, and then they could schedule that information, or once they complete that information, they'd be able to schedule that appointment. So once they enter the information, we have a proprietary platform that we run everything through. That's in our cognitive assessments, the program that we use, CogniFit, the brain therapies that we provide, our remote patient monitoring, and then also our advanced wound care. Everything is run through our Navora platform. They would fill out an eligibility questionnaire. Then they would schedule that appointment with our doctor to establish them as a patient. They would go through the CogniFit assessment. Once that assessment is done, that assessment gets sent to our neurologist, and then they do their interpretation of the assessment. So out of the 22 areas of cognition, they would review that, they would do their interpretation, and then that patient would get, I know you guys say clients, but and it's taken me because I go back and forth, and then our patients would get a follow-up call with our nurse practitioner. And then our nurse practitioner goes over the results of the assessment, any questions that they may have, talks about the cognitive training that we provide. And then that's where typically our RPM enrollment happens, is on that follow-up call, Elaine. So in the case where somebody would just need remote patient monitoring, we would do that in a different process. But they could reach out to me individually, but that's typically where we are doing our RPM enrollment. So if they're interested in that, or the community or group home is interested in doing RPM for all their residents, then we'll sign them up for RPM at that point. And then we would send them the devices. We would set them up as a clinic. So say it was Sunrise Assisted Living. So we would set up Sunrise Assisted Living as a clinic, and then whoever their point of contact, their DON, or they were managing that facility, would be able to log in and see Mrs. Jones and Mr. Blacks and every patient that's in there. They'd be able to see that real-time data. They'd also be able to print that out. So as a home care agency, you could have, if that was set up with the patients with HIPAA and everything, you could potentially set that up to where you would be able to provide that information for a specific client and send that to their GP. So you could log in, get Mrs. Jones activity on their RPM over the last month, or the patient themselves could share that. So there's multiple ways that we can do that. And then at that point, we could also set up a care plan development, which would be who's your point of contact, who's your medical power of attorney, who's doing your med management, who's your primary caregiver. So that's about an hour process. And then that 6-month reassessment is, we already have that establishment of the baseline assessment. And then you would see a 6-month reassessment. And that's simply for the Medicare. Medicare allows for an assessment every 6 months. So that would be like your follow-up, like you're cleaning for your teeth. You would do another assessment and then compare that with your original baseline. Does that
Okay.
make sense?
Well, I have a lot of questions, and I don't want to hog the questions, so people want to talk, please interrupt. But how long does the assessment take?
So the cognitive so I'll just back up just a little bit. So if you see this cognitive, I'm gonna just back up a few slides just so everybody can see.
And you keep talking about communities, and yet
Mhm.
we're home care agencies. So do you do individual one-on-one with people in homes, or do you only work out of communities?
Yeah, so we do both. So the remote where I talked about on that slide, the remote sign up would be something where the client would sign up themselves, or a family member would be able to sign themselves up. As you know, there's usually a primary caregiver, spouse or loved one would be able to go through that process. They'd be able to sign up on our website and then walk through the whole process. Everything's virtual. So in the remote piece, on the home care side, couple of the home care agencies that I'm working with have just a sheet with our information on it, and then the link to be able to sign up. It's just offered as a service that they're able to do, obviously, because like I mentioned before, there's people that are in denial. This gives them some concrete medical scientific data of where that individual is. So that would be how that would work for the home care agency, but we could set that agency up as a clinic. So, and that would be something that we would speak with as the owners and their team, how their HIPAA was in place, how the sharing of information was with their clients, if the clients wanted them to have access to that or not. Because our information, none of this information goes to any doctors. The only doctors that see the patient's information is our internal doctors. So we don't send that to anyone. We don't send that to any neurologist besides our own for interpretation. We don't share that with the patient's general practitioner unless the patient wants to share that. So that's what's nice about it as well, is that if they choose not to share that, then they can choose not to share that.
We talked in some instances about getting a doctor order for it. So if a doctor was giving an order, they would want to see it, would they not?
So that are you talking about the order for RPM or an order for the assessment?
Well, the RPM, you were talking about hardware.
Yeah, so that's all managed by us. We take care of all the billing. We take care, there's no cost for the equipment, and that from the doctor is from our internal doctor. Now, if the doctor, and like I said, that would be a different situation. Typically, like I said, we go through that typical workflow of the cognitive assessment. Some people qualify for remote patient monitoring. Some people want the remote patient monitoring. Some people don't. So that's up to the patient. If the doctor wants it to happen, we would still order it from within us, but we would have to get permission from the patient to be able to share that, unless we set that particular doctor up as a clinic.
Okay, thank you. Anybody else have questions? Everybody's good? You had all kinds of other slides on that. What were some of those other, kind of what were the things?
Yeah, I can run that. That kind of gives a little bit more in detail. I didn't want to get too commercial, so I wanted to talk about those therapies and things, but I will run through that real quick. All right, you guys see that okay?
Yep.
All right, awesome. All right, so like I said, we use a program called Cognifit. Cognifit's been around in Europe for 25 years. It was founded in Israel by Professor Shlomo Bresnitz. And over the last 15 years, they've really focused on the assessment piece of it and then the brain therapies. So Cognifit is the program that we utilize.
Okay.
The cognitive assessments and brain care training, like I mentioned, we have the exclusive licensure for Cognifit in the US. So if there is anybody, I always think, something is better than nothing. So people don't have to use us, but I encourage people to ask questions. So what is the scientific backing on the product? What's the medical part of the product? Is it treating not treating, is it helping with different pieces of cognition, or is it just a generic brain game? That's really the biggest thing. Is the way this works is the assessment piece of it is the main component, and I'll show that here. Again, our cognitive assessment battery, our CAB, is FDA approved, so we're classified as a computerized cognitive assessment aid, so we are a medical. That's another thing to ask. Kind of talked about that workflow, and I can answer questions on that. But this is the baseline. This is the goal, is to get somebody on the baseline assessment. This report, and I'll show another one, but the 5 main categories of cognition: attention, perception, coordination, reasoning, and memory. That's what we score that on. And then these are the 22 different subcategories, like I mentioned, of category, or excuse me, of the 5 main categories: reasoning, memory, attention, coordination, and perception. And then what we do is we break it down into subcategories. So shifting, planning, and processing speed are part of the reasoning category. What you're typically not going to see from a neurologist's office is a breakdown of this data. So this is what's really important, is that if you have short-term memory deficiencies, the games that we assign to that individual are going to be used for short-term memory. If you're playing a generic brain game, you could be doing something for hand-eye coordination or estimation, but you really need it in nonverbal memory or shifting. So the key component of this is the assessment, and then assigning those brain therapies. And they are games, but due to the fact that they are specific to that individual, they are the brain therapies. This is an example of the report. If you can see this, again, it's this breakdown of reasoning into the 3 different categories. What's really nice is this paragraph here, and for each of the 22 categories shows an example of what shifting is, or it shows what contextual memory is. And the last sentence of that paragraph shows an example. So for example, shifting is if you're watching TV and then you have to shift your attention to a baby crying in the other room. It gives an example for the families, and it's really nice to be able to show, obviously, ones that are in denial, but somebody that's maybe not around all the time, and now they're like, oh, I recognize that in this person. We had a gentleman who had some issues with medical history, took the assessment, and then really understood a little bit more of what was going on with him, specifically because he saw that breakdown. So it's a nice detailed piece of information. Again, our brain therapies target the deficiencies found in each one of those 22 areas. And this is just an example of some of the games. It's not anything crazy. It's not this crazy new technology. Like I said, our therapies are focused on the deficiencies, so we can keep that area of the brain active, and just make sure we're targeting the correct area. This is a graph. This is 1,125 users, a mean age of 61.6. And in this, if you look at this top here, this is the 5 main categories, like I mentioned before: attention, memory, perception, reasoning, and coordination. This is their baseline. So that initial assessment that I talked about, this is the percentile, the 31.5% in attention. After 10 sessions with CogniFit in the therapies, there was a 1.9% improvement. After 20 sessions, there was a 15.6, after 30, and so on. So you can see the significance of each category, and when you really stimulate a specific area of the brain, what brain therapies can do. Now, not everyone is going to have the same results, but that's a group of people that had done the brain therapies, and it just shows that increase. And that was a range from people of 50 years of age up to 92. So obviously, depending on where they're at in their journey, that's going to affect people as well, but they will have a baseline from the beginning of where they're at.
So these games can be on the computer or an iPad or a phone?
Yep, you can do all 3. We recommend a tablet. There are some limitations for the assessment. So if somebody's visually impaired, typically, unless if they have some vision and they can see a screen, they'll be able to take the assessment. But if they're completely visually impaired, they will not be able to take our assessment. Unfortunately, they will have to touch the screen, because there are, for example, our tapping test is equivalent to the fingertip NEPSI test. So that would be something that they would have to touch the screen. So there are some physical limitations as well. They would have to be able to do that. And then obviously there's a piece of it that coordinates into hearing as well. So they would have to have auditorial as well.
And so when you're talking about the remote patient monitoring, it's monitoring how they function on these programs.
The remote patient monitoring actually is completely separate. So this would be, so we would do the assessment. You would see that piece 6 months later on a second assessment, you would see the comparison. The remote patient monitoring is for folks with high blood pressure, hypertension.
Okay, so normal
those-
stuff.
Yes. Yep.
And to
Absolutely.
see how those things affect their cognition.
Well, it's just to help, it's to help maintain that that data recording. So whether it's a physician, whether it's a home care, whether it's whatever it is, if they have that need for a remote patient monitoring, it would be to monitor those different things. So we could
Okay.
implement a scale for weight, you know, those type of things. So we can implement different things, but the base package that usually is sent out is the blood pressure and ox monitor. So those are the two main ones that we typically run into that physicians are looking for to monitor.
Okay. Now,
And go ahead.
okay. No, I just now I know that I have a cold, so my head's not in the right place, but I was just trying to line everything up, and it makes sense now.
Yep. Different services, but essentially you can look at it as different service lines. Our cognitive assessments and brain therapies. Then we have our remote patient monitoring, and then we have our advanced wound care. So this is just some highlights. So we have over, like I said, you know, over 20 years of experience. We pull from over 1 trillion data points, which is something that companies can't say. We're in over 250 academic research institutions across the globe, and we have over 4 million users. And then here's some examples of some of the clinical and educational institutions that we're in.
Cool.
And then again, this is just a piece of the puzzle. So it's really up to that individual to take control of their health. Some people don't want to do that. Some people are excited to do that, but it really is a piece of the puzzle. And, you know, obviously as owners, everybody has resources of, you know, home health, speech therapy, OT, PT, nutritionists, all that. So, and hopefully the caregivers are giving them a piece of that social activity, but even getting them out for a walk and doing those kind of things. So we are a very large, detailed piece of the puzzle, but we are a piece of their overall health. So, and that's it. And obviously some statistics that you already know. But it's definitely essential that we talk about cognitive health and keep it out there in the forefront.
Absolutely. Any other questions from anybody? All right. All right. Well, if we don't have any questions, on behalf of the entire AzNHA board, I want to thank you, Brian, for participating today. Our next program is May 15th. As I mentioned, we will be having Sherry and Scott Nordstrom from Accredited Investment Fiduciary talking about new products and in long-term care that are extraordinarily accessible, and just a lot of tips about how to use long-term care to the best advantage for our clients. So thank you again. I hope everybody has a really great afternoon.